I know a lot of y'all have got lunch hour that you want to get this taken care of and learn tons about our health benefits for retirees today. So we are thrilled to have Terry and Hannah from UK Benefits with us today, and especially in the middle of open enrollment. I know they are super swamped, and I really appreciate them being here. For those who are joining online, I did send a message a while ago, but if you have a question anytime during the session today, just email or just send that to me on the chat icon there, and then everyone else will get as many questions answered at the end as we can. So now I'm going to turn it over to Terry. I think she's going first here. All right.
Well, hello, everybody. Like I said, I'm Terry and Hannah. We're both retirement officers. We're a good point of contact when any of you are thinking about retiring or getting close to retirement. We always suggest that you schedule a benefits meeting with Hannah or myself so that we could kind of personalize the meeting, because what we're going to go over with you today is very detailed. There are a lot of dates that we look at. And there are a lot of rules with retirement eligibility and if you get a health credit and where you fall in terms of what you would pay. So this is general in nature for right now, but when you schedule that benefits meeting, you'll have the most up-to-date information, and we will give you some handouts that you could take back with you. That's kind of your checklist that you could follow, as well as giving you a form letter that you're welcome to use for that intent to retire letter. So we find that most people find that the most useful to them. And then also we have a retirement conference in October 12th, and it will be on campus this year at the Student Center. So hopefully that's more convenient for everybody here if you want to know or just have a whole day of getting information about retirement benefits, but also not just retirement for our office, but just things to consider before retiring that we think is helpful for anybody that's looking to retire in the next 5 years. Okay, so I'm gonna get us started. I'm gonna get us started talking about what is UK's definition of retirement, and these are part of the administrative regulations. Early retirement is considered when you are less than 65 years old. Normal retirement is when you're age 65 or older. You would qualify for UK retirement. As far as rules that are in place to qualify for early retirement, again, you have to be for early retirement, less than 65 years old. You have to meet 2 criteria. Your age or years of service have to equal 75. We call that meeting the 75 rule. And you have to have 15 continuous years of service. So if you have met only one of the criteria, but let's say 15 years in, that obviously would disqualify you for early retirement. For normal retirement, the rules are a little different. You just have to be 65 years old. Regardless of your years of service, you would be eligible for normal retirement. But in order to get a health credit, you have to have 50 continuous years of service and have to be hired on or before January 1 of 2006, because anybody hired after January 1,
I'm listening to a thing.
You could be eligible to retire, but you would not get university contribution towards your health plan costs. Some more,
I'll do it.
with early retirement and normal retirement. With early, staff should give at least a 90-day notice. So you would turn in an intent to retire letter, because retirement is voluntary. So you have to make that known in writing to your department. We would ask that you would also submit a copy of that to benefits, because we actually retire you from the system for your department. And as far as health insurance premiums and what you would pay would be based on if you were eligible to retire on July 1 of 2007 or after. Anyone that was eligible after July 1 of 2007, their premiums are going to be more costly than someone that was eligible prior to that date. So when we do a service check to verify your eligibility, we're looking at all these details here. and we would tell you in a service letter where you fall in terms of health insurance. That's if you're in the early retirement category. For normal retirement, staff only have to give a 30-day notice, and premiums and access to the health plan is determined by your service years. So we're going to be looking at, do you have 5 years of service? Because if so, you have access to our plan. But if you have 15 years of service, continuous service, and you were hired before that January 1 of 2006 date, then you do get a health credit. Other things to consider before retiring is your finances. We encourage anyone looking to retire in the next 5 years. And even if it's much later than that date, you should always be checking in with your retirement carrier. If you have a financial planner, you've got someone you could can look at your financial well-being. They're doing a pre-retirement illustration for you to see at retirement what kind of distributions available for you and how long is that money going to last you in your retirement years. That's usually when people start to really look at retirement, is when financially they're in good shape. We have retirement carriers that could talk to you on campus. You can have a one-on-one meeting as often as you'd like with them. But we also have in our benefits office a financial well-being officer, Todd McCauley, that you could sit down with, who could give a second opinion to the information you receive from your carrier, but would also look at other sources of your income and giving you a perspective of how you're doing. And I've already mentioned this already for early retirement. So we're looking at your age, your years of service to determine if you qualify, meet that 75 rule, and if you're eligible. If you were eligible prior to July 1 of 07 or after, because that tells us whether or not you're going to be in that age service table. That will be on the next slide. But we welcome you to contact us in retirement to do a service check. If you don't have one already, might be helpful to have one already available to you so you know where you fall. And if you're not eligible to retire yet, we could project when you would become eligible. So moving on to what the health insurance would cost you, and this is information for this next fiscal year. And this chart here is going to show you what your premiums would be if you were eligible to retire as of July 1 of 2007. So let's look at someone on an HMO plan, retiree only. The total cost of that health insurance is $813. We're receiving a $732 health credit. So UK is paying this for you, which leaves your monthly premium to be $81. You'll see if you're adding dependents, you're going to pay more for your health insurance at retirement. UK doesn't give any contributions towards dependents at that point. So if you had to add a spouse to your HMO plan, that total cost of the insurance is $1,622. UK is still going to give a $732 credit. You're paying $890 per month. And I'll just point out here at the bottom. So basically, if you became eligible on or before July 107, your cost is only 10% of the gross premium. UK is taking care of 90% of that cost for you. So you're in a good group if you fall in this category. If you're on the RHP plan, many of you probably already know that changes are occurring July 1 of this year. That plan cost us more money, and therefore the premiums had to go up slightly for that group. So if you're on an RHP plan, that total cost is $818. UK still contributing $732 of the cost for you, which leaves a premium of $86 per month. PPO, that doesn't change. It's the same as the HMO. EPO plan is our most expensive health plan. Don't have a lot of people that take this insurance because it's really designed for someone who's a high user of a health plan, in and out of the hospital a lot. And that total cost is $1,085 per month. UK again contributed $732, leaving with a monthly premium of $353. Because you could see usually people at this point in retirement, they look at switching from an EPO plan to a PPO plan. And we could sit down and personally just kind of review how that would work for you. There's a lot of misconceptions about how it works. So that meeting with us is very helpful. Okay, this is the age service table for anyone on the HMO or PPO plan. You'll see that if you're in this group eligible after July 1 of 07, you're going to pay more for your health insurance. The more years of service and the older that you wait until to retire, you're going to be paying much less of a service or much less cost for that health insurance. So if you're less than 60 looking at retirement, you only have your 15 years, but less than 20 years of service, you're going to be paying much higher percent, I think 80% of the cost, which is $650. But if you were in the same age group and you had your 25 plus, it's only $325. So UK is going to contribute more towards your cost. Obviously, if you delay retirement, let's say you were looking at retiring around the age of 62 and you had your 25 plus, UK pays more for your cost and it leaves you with $203 per month. Adding dependents is going to run a much higher premium for you because you have to add $404 if it's children. If you're adding your spouse, you're looking at an additional $809 to what you'd be paying up here, for example. Again, UK doesn't contribute to the cost of dependents when you add them at retirement, unfortunately, because it's very expensive. Okay. RHP plan cost is going to be higher because it's a higher cost insurance. So just looking at someone that might be less than 60. Retirees at this point don't take the EPO plan, but it's certainly an option still on the table. You would be paying a much higher premium if you're on an EPO plan. Just looking at the less than 60 group with your 15 years of service, you're looking at $868 per month. But if you had your 25 plus years, it's $434. So it's a very expensive health plan once you're looking at retiring. So we often sit down with folks one-on-one and evaluate, okay, what is the difference in coverage versus having a PPO plan, because there's an out-of-pocket max that would help someone out at this point on a PPO plan compared to what you're paying for premiums per month. It's not very cost effective at that point.
I have a question on that one.
Yes.
If you, each year you have to enroll, so each year you're going to get older, do those amounts go down?
I'm glad you mentioned that. I should have mentioned that earlier. Okay, so her question is, when you retire and you're a certain age, will those premiums lower when you've had another birthday? And the answer to that is no. You are locked in at that age and years of service, obviously, at retirement. So at open enrollment periods each year, these premiums, they can go up slightly. Since I've been in benefits, each year we've seen these age service tables go up by 5 or 6% in costs. So that can add up over time. But no, you are locked in at that age and years of service. Let me say also that when you are 65 and your Medicare starts, you've already retired, no one is in an age service table at that point. At that point, everybody's in the same boat. They're in the same group. And it's a much less cost for you at that point. So we'll look at that in just a minute.
Are you locked into, like, say, the year before you retire, you're in EPO and you want to change to HMO? Is there any kind of condition you have to stay with insurance you can change it all the way to retirement?
So retirees have open enrollment periods just like employees do. So at that point in time, you want to switch from an EPO plan to PPO plan is usually where we see the move. So you have that more access to providers. Yes, you could switch at open enrollment. Yes. And okay, so I think I just talked about the EPO, didn't I? I just didn't switch over. This chart here is going to show you the percent of medical premiums the retiree pays if you are in the age service table group. So someone that's not yet 60 years old and you have less than 20 years of service, you're out of pockets. You're going to be paying 80% of that cost. So if you're working longer and you have your 25 plus, but you're still early retirement, less than 60, it would be 40% of the cost. If you work another few years, delay your retirement, so you're in a lower group, let's say you had your 25 plus years of service and you were 61, but you were getting close to a birthday, when we're meeting with you in benefits, we might point that out to you that, hey, if you wait 3 more months, you're going to have another birthday. You get locked in at a different premium, a much lower premium, and instead of 35%, 30% would be paying 25% of that medical care cost. So that's where our meetings one-on-one can be very helpful to someone if they're on the fence about retiring now versus waiting another 1 or 2 years. Again, I want to point out, it's right here at the very bottom of the slide, when you're 65 or older, everyone pays 10% or $33, whichever is higher. Okay, so you're not in this age service table at that point when you're on Medicare. I'm going to move into normal retirement. Normal retirement, again, is when you're 65. Regardless of your years of service, you reach the age of 65 years old at the university, you are eligible for normal retirement. However, for the health insurance rates, it's going to be based on your years of service unless you were hired after January 1 of 2006. Remember, anybody hired after that date, that was your date of hire, there's no health credit. You have access only to our health plan. So, for example, if you're 65, you're eligible, you want to retire, you have less than 5 years of service, you're not going to have access to our health plan, unfortunately. But you still can participate in our dental and vision benefits. And we often have many people that retire, but they still keep our dental and vision plans. But if you have under 15 years of service, so you've reached the 5 years of service mark, but still less than 15, unfortunately, there's not a health credit, but you do have access to our health plan at that point. Yes, in the back. Health credit, when we use the words health credit, that is UK paying for a percentage of your health credit. So when I was pointing out in the charts earlier, the total cost, that second line there in the chart is showing you what UK's paying on your behalf. Okay. So for normal retirement, if you have access only, you would have to look at the total cost of the insurance because you have access, but UK's not contributing anything for you. And we do have many people that are Medicare eligible that do still take our health plan, paying that full premium, and having a benefits meeting with Hannah or myself, we'll point out where you could perhaps save money on our health plan. There are cheaper insurances out there at that point for supplements to Medicare, but on the pharmacy side of our benefits is where you may be might want our health insurance because of coverage gaps with the prescription plan. And I think Hannah will get into that here in a few minutes. And again, with your 15 or if you have 15 years of service, you were hired before January 1 of 06, you're in a good group, you're going to get a health credit. You're only going to be paying 10% of the cost of the health plan, which is $33. And we can tell you confidently that you will not find a supplement to Medicare cheaper than that $33 rate because it includes the Part D Express Scripts for your prescription plan. Okay, this is where I'm going to turn it over to Hannah, and Hannah's going to go over with you more about how Medicare works with the carve-out classic plan that you would have access to.
So I'm Hannah Farmer. So I talk loud. So if you can't hear me, just let me know. Just raise your hand. So with Medicare, there are 4 parts of Medicare that you need. Part A is your hospital insurance. It's free of charge. So if you are 65, still working, you can sign up for Medicare Part B only, or Part A only, because it's free hospital. It may help pick up some of the deductible if you're ever in the hospital, especially with the PPO plan. With Medicare Part B, do not sign up for this until you retire. If you retire before the age of 65, you can sign up for Medicare Part B. You do this 3 months before your 65th birthday, your either 65th birthday month, or 3 months after your 65th birthday. And you can do that online. It's very quick and easy. I've helped a few of my coworkers do it. For their Part B, there is a cost for it, and it's going to be determined based on your modified adjusted gross income 2 years prior, either 2 years prior to you turning 65 or 2 years prior to retirement. So if you decide you're 68 now, you are retiring, it's going to look back 2 years prior. So they're going to look back on your 2016 modified adjusted gross income. Right now, that premium minimum is $134 a month, and this will come out of your Social Security check. If you're not taking Social Security at the time, because a lot of people, their normal retirement age for Social Security is 66, they will bill you. For Part C and D, that's going to be covered by the carve-out plan. Part C is similar to a Medicare Advantage plan. So on Part B, it's going to take care of 80% of your medical cost. So that's why you need that supplement. Our supplement, called the carve-out, is going to take care of 80% of that 20% Medicare doesn't cover. So your out-of-pocket is 4%. But usually after that, there is a deductible in this plan, but after that deductible has been met, that 4% is usually less than a copayment. And then your Part D is your prescription coverage, so your medicines. It's going to mirror the Express Scripts you have now as an employee. So you kind of know how much your cost of your prescription coverage will be. And then on our Part D, we do not have any donut holes or coverage gaps. Some of you may are known of those names. But we do not have that. So if you are on a lot of medicines at the time of retirement or later on, you want to pick us up, you can, because we don't have any donut holes or coverage gap. For our insurance, you can defer our health insurance one time during retirement and come back to us. So if you decide to retire early, you're paying that higher cost for that premium. You can maybe go out elsewhere, find a private plan, go on a spouse plan, and then maybe come back to us at the age of 65. Whenever the cost is a little lower, especially if you get that credit. So billing on Medicare. So when you're on Medicare Part A and B, they will be your primary insurance. UK will be your secondary if you decide to take UK. But if you don't decide to take UK, your supplement will be your secondary. So Medicare is going to charge 80%. Then Anthem, if you decide to take our plan, is going to cover 80% of that 20%. So your out-of-pocket is that 4%. And they will charge you later on. So you'll never have to pay a copayment up front when you're on our carve-out plan. Just be sure to sign up for Part A whenever it comes time and you're still working for Medicare Part A. And then for Part B, either myself or Terry will help you enroll in Medicare Part B when it comes time to retire. So for normal retirement, those health premiums, if you receive a credit, it's going to be $33 a month. If you're going to add the spouse, they're going to be $363. So the spouse again does not receive a health credit. At this time, I usually say drop your spouse because they can find a cheaper supplement than $330 a month. And you're only paying 33. Save you some money. You're on a limited income as it is. If you do not receive a health credit and you add your spouse, it's going to be $660 a month for our carve-out plan. So that's quite expensive. Again, you can find something else because I wouldn't even pay that. Unless I was on a lot of medicines. If I was on a lot of medicines, I definitely would. So for normal retirees returning as a working retiree, you can come back either in a post-retirement or a working retiree position. So, and you'll get get our benefits. You are temporary non-benefits eligible. So you please notify either myself or Terry when you decide to come back, if you decide to come back. If you're working more than 20%, guess what? You don't have to go on Medicare. So that's saving you a minimum of $134. But if you're working less than 20%, you're not going to get that credit. But I'm going to talk to you about that credit here in a second. So if you work more than 20%, which is 8 hours a week or more, if you're a faculty member that's teaching maybe one class a semester. And this could get you a credit for our health insurance. For the first year, you're going to fall under the Affordable Care Act, so the ACA. You are going to get the same health insurance rates that you're currently paying as an employee. After year one, that's when the rates do jump up, and I'm going to show you those costs here in a second. So first year, you return to work, you're working that minimum 8 hours a week. You can keep the same health insurance costs, not go on Medicare. So currently that's $261 for employee plus spouse or $28 for the employee. You can pay that for 1 year, work 8 hours a week, 32 hours a month. And then after year one, those rates jump up. So for those rates, again, $31 a month it's going up to for the next fiscal year, July 1st. So if you're on the HMO or PPO, you work those 20%, 8 hours a week, $31 a month. If you add the spouse, remember, first year, you fall under the Affordable Care Act, it's going to be $265, I'm pretty sure, for you and your spouse. After year one, it jumps up to $560. Again, drop your spouse, save money. So phased retirement. So we did change the rules a couple years ago where it was 5 years, now it's down to 3 years. So you can, on phased, you can do between 50% and 80% FTE. You must be over the age of 60 and be eligible for retirement. So you must have your 15 years of continuous service and be over the age of 60. So on phased retirement, all costs stay the same for your benefits. So same health, dental, vision, all the same cost. And as well as you're contributing to your retirement plan. So you're for that matching for retirement. And you can have access to your contributions, so your TIA or Fidelity, to subsidize your income that you are losing. So if you work 50%, you can take 50% of your salary from TIA if you need to. So what changes on phase is your salary, of course, because it's going to be based on your FTE, as well as how you accrue your sick and your vacation time and what's going into your retirement. So all of that is going to be based on your FTE. So if you're working 50% and you're an 8-hour shift day or 8-hour work day, you're going to get 4 hours of vacation kind of thing. On phase retirement, there is an application online that you will need to complete. There's about 5 signatures, and you'll work with your department on those. I'll sign off on the first one, either myself or Terry, for the first signature. Then your department will sign off on the next 3, and then they're going to bring it back to me for the final signature. But we'll work with that when the time comes. But there is an application online. For the retiree dental plans, so we no longer have the UK Basic and the Comprehensive. Now we have the Classic and the Ultra plan. So it covers a little bit more, and you're also paying a little bit more cost. But on the Classic plan, all preventative care is covered at 100%, and minor I can't speak today. And then as well as the Retiree Ultra, all preventative care, as well as and then orthodontics benefits are available for all participants. So for the Delta Dental, there is the basic and the enhanced still. And those rates are going to stay the same, as well as the same exact plans if you have the Delta Dental. So for the rates for the 18-19 year, for the retiree only, if it's for the classic plan, you're paying $17.12. And then for the ultra plan, you're paying $38.12. So this is going to be more like an HMO. So if you decide to move whenever you retire, you may want to switch to the Delta Dental. If you do move during the year, you can use that as a qualifying event to change your dental as well as health insurance if need be. Oh, I did forget to mention, while you're on Medicare, you do not have to see just UK doctors. You can see any doctor that takes Medicare, since they will be your primary health insurance. And then for the Delta Dental plans, again, they're going to stay the same rate, $24.40 for the retiree only, or $33 for the enhanced. And then for the basic for retiree and spouse, it's $51.90, and retiree only $72.80. For the vision, this is like a PPO coverage. All the rates are going to stay the same. So if you have the essential plan or the enhanced plan, same rates. The biggest difference between the two, on the enhanced plans, you get frames every 12 months versus frames every 24 months on the essential plan. And again, the rates are going to stay the same rate into the next fiscal year. If you have need any good reference points, these are some reference. We're going to probably email these out to you after the presentation, so if you need them. For payouts, so if you were hired before July 1st in 1995, you will get a vacation payout. If you were hired after it, you will not get a vacation payout. So if you were to receive a vacation payout, you're going to get 22 days at your full salary. So if you're an 8-hour work employee, you're getting 176 hours at your full salary. Your remaining hours are going to be at 10% of your salary. And this is all going to go onto your final paycheck. So you have the option of tax sheltering, so you can take that money and roll that over into your TIA or Fidelity. For vacation, you will get up to a year's worth of accrual. So if you're an 8-hour work employee or 40-hour week work employee, it's 160 hours if you're over 9 years. So if you have anything above 160, be sure to use it or you'll lose it. So. And for the TDL payout, prior to July 1st of 95, you will get it paid out to you as long as you have 66 days. If you have less than 66 days, you will not get it paid out to you. And myself and Terry will do an approximate calculation for you during our retirement meetings if you would like to know. You can also use your sick time to move up your retirement date. So if you are close to that 25 years of service, you can actually, and you have over 66 days, you can move up that 25 years of service using those sick days. And either myself or Terry can do that calculation for you as well. And then here's some contact information. So I'm Hannah Farmer, and that's my number, as well as Terry can answer if you have any questions, as well as your financial well-being officer, Todd McCauley. He's wonderful. So if you need those numbers here, he offers 4 free visits a year if you ever just want to talk to him. I mean, I talked to him about buying a house a couple years ago just to go over budgeting. So, as well as our benefits contact. So if you have any questions about your pharmacy benefits, if you have any medicines that cause you a hardship, contact our pharmacy group. They may be able to find some coupons for you. We do have a benefits advocate. If you ever have any claims issues with your medical bills, we have Debbie Martin. And as well as you have any billing issues after you retire, we put you into our direct bill. If you have any of those issues, you can contact Donna Henry or myself. We're used to taking those phone calls. As well as retirement counseling. So remember, when you're getting close to that retirement age, I suggest you meet with your retirement carrier annually. If you're my age, I don't see them that often, every few years, just to see if you're going in the right direction. And they will meet you here on campus, or if you're not on campus, they can meet you at your office. And there's their number there. So our financial counseling, it does say 5 visits for Todd McCauley. It's actually 4 at no cost, and it's per year. He'll work around your schedule. He'll meet you on campus if need be, or you can come by our location. We're actually located on Export Street in the credit union on the second floor. So parking's great over here. So, and then just educate yourself with TIA, Fidelity, Social Security, our benefits, financial counseling, elder care, health and wellness, and our Oscar Lifelong Learning Institute. So, and that is everything. Anybody have any questions? What? Oh, yes.
The first one is, after you retire, do you have to pay to talk to Fidelity or the TIAA rep?
I don't think so.
Come back to campus for free session?
Yes, you can still talk with the representatives. You can still talk with representatives from them, yes. Okay.
So if, my domestic partner is 7 years younger. So if I'm eligible for Medicare, but he's not, and I have UK HMO as the secondary, so I have Medicare and UK HMO as the secondary, is he eligible for that health insurance that says employee or spouse only $31 or what, $81 or whatever it was?
Well, if I heard you correctly, so you would need to go on full Medicare. We call this a split plan. So you would go on full Medicare. You would not remain on the HMO. You would need to go on the Medicare Carve-Out Classic. Your premium would be $33. And for your spouse, the UK HMO is going to you have to add $809. So he would pay that $809 to remain on the HMO until he's 65 and Medicare eligible. Then we would have you on both the same plan.
But I thought there was another slide before that was
Oh, that one.
employee or spouse only UK HMO.
This one here?
Plus 81.
Oh, that one. So remember, this spouses do not receive a health credit. So you saw this retiree or spouse. Spouses do not receive a credit. So if you were to pass away, they would receive a credit. But if you were on it at the time, then you would not receive.
Why didn't it do the carve out with UK HMO? Could that number be used as spouse only?
No, because
If I did my secondary with something else.
well, in order for him to be carried on the UK plan, you have to be on the UK plan as well. So you would want to stay on, I would think, just because you would get the lower premium anyway. But yeah, it didn't work that way where he could take our plan and you would go somewhere else. You drive his plan, so you have to be on the health plan for he to become eligible, and you would have to stay on the Medicare. Because of Medicare and you no longer working, you have to be on Medicare at that point as your primary.
So if I was working. So if I worked 8 hours a week, then that would.
So if you retired and came back through steps, that would change things. Then we're looking at the working retiree rates.
561 after year 2. 560 after year 2.
And with the AC and what she was going over with the Affordable Care Act, if anything at all, the provisions change with the Affordable Care Act, that could go away. Because the first year, that would be quite a savings for someone that's carrying a spouse. So if that does go away, the working retiree rate sheets, this is normally what we hand out to someone, and we verbally tell them about the ACA rules because that's on the table. We don't know how long that's going to be in place. So this is the worst case scenario of the $581, or I'm sorry, for $560 is what you'd be paying worst case scenario if you retired and immediately came back in a steps position.
Question from online. Is there something significant about the 62.5 years? Is it the Social Security eligibility?
62.5. I've never even heard of 62 point. I mean,
I mean,
62 is when
maybe-
Social Security starts.
I mean, maybe they're thinking that Social Security, they would be eligible for Social Security, which is a completely separate thing that we would not be able to help them with, that they would need to talk to Social Security about. But as far as their insurance with UK, they're still employed at UK, then obviously they would stay on your UK plan. Medicare doesn't even begin until 65.
Are they asking about Fidelity at 59.5? The carriers? Okay. Okay. I'll say if it's 59.5, that's usually a big question we always get asked, whether they retire before 59.5, will they be penalized? You will not be penalized if you decide to take your TI or retire Fidelity contributions if you were to retire. You have to be as 55.5 and you won't be penalized. So everyone always hears about that 59.5. So if you were to retire before 59.5, you will not be penalized.
And they're welcome to contact one of us, and we could talk over the phone just to try to figure out, okay, what are they asking, and maybe try to get an answer for them. Okay.
They want to know who would be the right person to talk to about long-term care insurance.
Long-term care insurance is a benefit through the NPM group. So they manage all of UK's voluntary plans, and at retirement, they would need to contact NPM so that they're aware that, okay, in 30 days, for example, they're not going to be receiving UK paychecks anymore, where those benefits are being payroll deducted. So they have to work directly with the carrier so that those benefits can be taken back. It is a portable benefit they could take back with them. They're just paying for it differently. Any other questions in the room? Yes.
I didn't quite understand when you retire and then come back to work, and then the first year there was a dollar amount, and you said that it would jump the next year. I don't understand. How does that work?
It's based on the Affordable Care Act.
Okay.
So for the Affordable Care Act, you're going to get that lower rate because you kind of measure in to the next fiscal year as far as hours wise. So you're going to get that credit kind of thing based on the Affordable Care Act. After year 2, you're not going to measure in unless you are working 30 hours a week or more. And to me, that's not retirement. So since you're not going to measure into year 2 based on your hours from the previous fiscal year, then it's going to jump up to that 561 if you have a spouse. Or if it's just you, it's still the same rate. So it's $31. So.
If you retire, can you, in that 90 days, that you have to give a notice, give some of that for vacation?
Okay, so her question is, can she use vacation during that 90 days that is recommended for you to give for retirement? As long as it's okay with the department, it's okay with us. You can even take a vacation day on your last day, as long as if it's okay with the department. So a very popular date to retire, January 1, because you get all your bonus days and you can retire on a holiday. So.
And you are allowed, you can retire on a holiday. The separation policy states that you have to work your last day. But if you look at the holiday policy, there's a provision in there if you're retiring, not separating, retiring from employment. And it's the very, very last bullet. It states that you can retire on a holiday if you're retiring. So that's a question. Often departments get confused on that policy, and they may, so we give that information in our retirement meeting. They turn in a letter to the department and they're saying, well, you have to actually come and work the next day. If that question comes up, just point out to them, well, that's actually in the holiday policy, or you could speak to the benefits retirement officer and they can explain that to you. That is allowed. There's some confusion we hear often, usually in healthcare, but most campus areas seem to get that policy very well. Yes, in the back. I mean, we say look at the holidays around the time period. Often we hear that people want to leave right before the bad winter months come around. And so they're thinking the end of the year, but we tell them, well, if you retire the end of December, you're going to lose all those bonus days. So if you make it January 1, you get that holiday paid, and then all your benefits are covered through the month of January. So I look at, like she said, January 1 is probably the most popular day because it's also, you're in a new tax year. So if you're getting a large payout, that helps, I think, with taxes for you for that year. Faculty members, I don't know if we've got faculty in the room, but faculty members usually have to retire at the end of their contract year. So it would be the end of a physical year, or they'll make it the end of the fall semester, which is December 31st. They don't always have that perk there. That it just depends on if they're teaching faculty or not. I mean, it just all depends really on your personal situation. If you want to make, be available more through the summer. But if you work one day of the month, your benefits are covered that whole month. So that's one thing that we see typically people do is they retire more at the beginning of a month so that they get their full coverage the whole month, because that next month you're going to be paying a little higher premium for your health insurance. So it saves you a little money.
If you don't retire at your full retirement age, and if you make too much in a year, then your Social Security benefits would be reduced. So like what you're saying is right to go, this is my understanding anyway, to go into the new year so that your Social Security benefits wouldn't be reduced by your previous income from the year if you are less than the full retirement age.
And see, that's where, now we can give you the information on UK. When it comes to the Social Security benefits, the income part of Social Security, we cannot advise on that in benefits. So you really need, there are some provisions there that you may want to talk with the Social Security office, schedule a benefits meeting, as if you're going in to apply for benefits. They will meet with you. You don't have to take the benefits once you get the information. But that's all Social Security. If you've got a financial planner, they typically would have the information to advise you. I don't know how much Todd gets into that in our office. But that's more Social Security. That's just a separate conversation you want to have with them, because they are the expert and everything is so different for everybody in terms of what you're entitled to. That's good to know. I didn't know that. I did not know that. So I will repeat that. Okay, so you could call the Social Security office, give them or tell them you want someone to call you back. That way you could at least talk with somebody at a time period and you could get those Social Security questions answered versus having to go to the Social Security office. Were you on the phone for a while before you actually were able to talk with somebody?
They called you?
Oh. Okay. That's shocking. That is very good information. Okay. Thank you for that. Mm-hmm.
Yeah.
I just want to clarify something and make sure I understand it correctly. So if I had 25 years plus service, I retired age 60. And I'm eligible to retire. So my rate would be $325 a year. And that stays $325 until I turn 65.
It's going to probably go up. So her question,
Well,
yeah.
Whatever the rate.
You're locked in at that matrix. So this, between now and June 30th, you're locked in at 320. And then at July 1st, it goes up to 325. She was asking whether she retired at the age of 60 and had 25 plus years of service. So
it would stay that until I turn 65. And once I turn 65, then it goes to the $33.
yes. So you're locked in at that rate until the age of 65, and then at 65, it goes from 325 down to 33. So
But at open enrollment periods, just remember it can go up. Like it goes up maybe 5 or 6%. It seems like every year since we've been in benefits, which, that can add up in that time period. But also, if you in the midst of retirement, you come back through steps at any point, they notify us anytime that someone's a working retiree, we'll go in and lower that premium.
oh wait, hold on, let's get this one real quick. Which one? Yours first.
What if you are a working retiree who is working more than the 75% FTE after year one? Would you still get to keep the ACA rate?
Yes, you will get to keep the ACA rate because you're going to measure in because you're full-time hours. So yes, you will receive that credit again. Yes.
At one time when Joy Payne was here, there was discussion of adding another column to this service matrix, 30 years. Is that anywhere? Is that floating out still? Discussion?
Not that I know of. Her question was if we're going to do a 30 plus years of service instead of 25 plus. I have not heard anything.
Yeah, Joey normally would not give that information out, but it was, it was, and it really got very far, and he felt horrible about that because, he felt like that was a done deal. It's so much of a done deal that we could present on it, and we were presenting on it. And then that was the year that there was some major budget cuts that was coming down from the state government. So that just immediately took it off the table, unfortunately. It was because there's a good group of people that have the 25 plus that could have benefited from that. Yeah. Yeah.
There's a slide after this with the percentages. That one? Does that mean that you pay $325 a month and then you're paying 40% of your bills also, or is that 40% the 325?
It's 40% of the premium. So yeah. Yeah.
Yeah.
Yeah.
But it was the 30 years that dropped out. It was awesome.
Yes.
It was awesome. It was a huge
Lisa, do you have any more?
service.
Oh, a lot of questions. Okay. Okay.
I'm sick of it. Sick of it.
They want to know if you have UK HMO for regular health care or traveling for a few weeks out of the year, just domestic travel, that is your emergency care still covered under the front?
Yes. That was an easy one.
You said when you have Medicare and the carve out, you can go to any doctor, any hospital.
Yes.
You're not locked in.
No.
You just have to make sure. So when you're Medicare eligible, you're on the Carve Out Classic plan. Providers anywhere in the country, as long as they take Medicare, Anthem is going to pick up as their secondary payer. So that's all you need to worry about. Does that doctor take Medicare?
Yeah.
Oh yeah, they do that. Okay. Okay, so the next question is, let's see, so either early or normal retirement, if you were hired after January 1st, 2006, you will not receive the health care credit. Is that correct?
That is correct. That is correct. You will have access only. So if you're Medicare eligible over 65, that's going to be $330. If you're under the age of 65, it's $809 a month for your health insurance cost.
And my next question is to define immediately. Does that mean no gap at all in the work? What about returning after a 3-month period?
So if you return within a year of separating, or if you went on an on-call position, so if you came back within a year, we will still count those years of service as continuous.
The next question is, what about pre-Medicare eligible?
I'm not quite sure what pre-Medicare eligible. So you're saying before 65, you're going to fall either into our age service category or you're going to fall traveling care. Oh, so traveling care, if you're on the HMO, is if it's an emergency, they will cover it. But if you are on the PPO, it's just as long as you go to an Anthem provider. If you're traveling outside of the country, if you're not over there longer than 120 days, then we'll do emergency only. If you're over 120 days, you'll go on the indemnity plan.
Okay, I think we've tried to answer as many questions as we can, and we're out of time right now. So you will receive the copy of these slides, and this will also be put on our YouTube channel. So you will receive an email with all of that info, and also info about how to contact Hannah and Terry directly, and they are more than happy to answer any questions or to refer you to others in the benefits office as well. Thanks everybody for attending, and we hope to see you again soon. Thanks. Bye.